Yes, so I was explaining this proportion and regarding the expected frequency. So I was telling you that just concentrate that this smoker and non-smoker status is not there. So I am considering that this overall, this is the overall total. This was the observed and this was the expected. Right. So that's why in overall you will see that this is both are equal, because in this expected is what observed is 132 and 48. That means out of 180 study subjects, 48 they required oxygen. So if I maintain the same proportion in smoker and non-smoker, that means that there is no association between the smoking and oxygen requirement. And that's why I did. So what I did, that out of 80, out of 180, if 48 people required oxygen, then out of 122, how many will require? So how did I do that? So what I have done, I have used the calculator. And what I did, it is not getting minimized. This is yes. So what I'll shift this to this place. So out of 180, 48 required. So in one, what will be there? 48 divided by 180. This is the proportion. 32. And then you have to multiply this by 122, because in 122, how many will be there? So you can see that this is the 32.53. So 32.53 is the proportion, that is the expected proportion, which you can see here. 32.53. Have you understood the meaning of expected now? I don't know whether you have understood it or not. No. Okay, good. At least someone said yes and someone said no. Okay. What is expected means I assume that there is no association between the smoking status and oxygen requirement. So whatever is the overall proportion, that same proportion I'll apply in both no smoker and in yes smokers. Right. That is expected. So expected frequency is when I assume that null hypothesis is true. What is null hypothesis? That means there is no association. So I'll apply the same proportion. And that's how I did it for this 32.53. Okay. So that's how whatever formula which you read, like row total into column total by sum total, that is nothing but a unitary method. Unitary method means, like we have read in maths, that out of 180, if 48 people, okay, I'll convey the other thing. Out of 180, 48 people are oxygen they required. So out of 122, how many will require? So this will be 32.53. So that is the expected. Now, someone said that they don't see any rationale of using this expected. But no. Larger the difference between observed and expected, then only you can say that the null hypothesis is not true. Whatever you are expecting overall, if you are not finding the same, because observed you can see here, observed is 48, expected is 42, observed is 10, expected is 15. There is association between observed and expected. Higher chi-square value you will get, and you will get the p-value less than 0.05. Again stuck. Yes, I think my connectivity is better. So did you understand this? Observed and expected. There is a value, definitely. You cannot say that there is no value of this expected, because the whole calculation is based on expected. And just try to understand the concept behind expected. Expected means gender has got this oxygen status has got no relationship with the oxygen requirement. So uh, yeah, so I have like said that no, there is a difference, and oxygen requirement is different with the smoking status. Okay, so that's how you will see that there is a difference between observed and expected. So you always check the assumption. So the first assumption was there should be two categorical variable. So we see that both these are categorical variable. Second assumption is that it should have two or more than two categories. So it has got more than two category. Yes. So one participant has answered. Ankita has answered the question which just now one participant has asked, because it's a dummy data. We have created this for the workshop purpose. There are some, it's entirely not a dummy data, because this was the data of patients which were admitted during the COVID time. We have done some modifications in it. So don't go by this like what can I say, like biological plausibility. Because you said now, how can a smoker will require less? Agree. But don't go by that biological plausibility. And many times it happens actually also. That we have seen it happening, that you will find something which you cannot explain. Then there comes the role of confounder and role of data collection, how that smoking status or oxygen requirement was collected, who has entered the data, and all those things will come into play. But currently, we are going into the and you cannot refute anything. Yes, Dr. Devnagar is correct that you never know. Your data is showing this. If you are too much confident that you have collected the data correctly and did the definition correctly, yes, there may be confounding factors. And the invent of confounders are like, we have defined confounders. And if you go the classical history of epidemiology, all those pancreas and cancer, those studies, the confounder concept came from such observation only, that you are finding something which is not fitting into that concept of biological plausibility. And here we will see that, yes, that's how you do the stratification. And you know that there is a mental Hensel uh, trend. We check for the trend and you stratify and see it, whether there is any confounder or not. So no, we don't, we never write the expected in our table. We only write the observe. And observe to here, I was just showing this for understanding, and you can check this, that each cell, since in this case, the observe, all the sample size is approximately 180. So 180 2 by 2 table, no way you can expect any cell to show a cell frequency less than how much? 5. But in thesis, you will often see this, that there are clinicians who are coming to you at the sample size of 30, at the sample size of 25, even 20, and they have applied chi-square. So you will see that in some cell you will find, or what they do, that they make 4 by 4 contingency table, or even we have seen 5 by 5 contingency table. So then in each cell, you will see that there are sparse data. And that sparse data will now again create a bias. So if the contingency table, number of contingency table, like it's more like 3 by 3, 4 by 4, or 5 by 5, then you need to club the categories. Then don't apply if the sample size is less. If the sample size is very huge, then you can go with the multiple contingency. But if it is less, go for 2 by 2 table. In that case, you can club the categories. You can club, like if there are 4 categories, suppose BMI, you have made 4 categories. So you can just club it to 2, no obese versus obese, something like that. So clubbing the category will help you in getting the expected cell frequency more than 5. Otherwise, you will have to go for the Fisher exact. And Fisher exact also, you cannot apply Fisher exact in n by n. It is only for 2 by 2. Okay. So if you have understood up till this level, we'll go one step further. Are you all on the same page? Are you getting till now whatever we have talked?
Yes, ma'am. Yes, ma'am. We are getting.
Okay, thank you. So then if the chi-square value is significant, then what you can do, you can go with the application of that, what factor which we have done, that effect size. So I'll uncheck this expected count because I have just used to demonstrate it. I will uncheck this and I'll click the percentages probably. So percentages, again, if you click percentage, you can apply the same percentage. It is out of 100, it is 0.27. So if you multiply this 122 with 0.27, you will get this number, right? Expected one. So not this one, sorry, this was the expected, if you see the expected count proportion. So leave this, whatever I was telling. And then comes the value of, this is your effect size. So phi and Kramer V is the effect size measure. And you see that it is the 1.15. So for 2 by 2 table, generally you take Kramer V for everyone. So it is 0.1. So what will be the interpretation of 0.1? So it is a 0.1 to 0.3, it is a moderate effect size. So you can say that this is a moderate effect size, and you will see only, you will click this only when this P value is significant. When this is significant, then only you will say that this is a significant, that means effect size you can comment upon. So now coming to the another exercise, which was the another exercise, oxygen requirement with the disease severity. So oxygen requirement, and I will move this back to disease severity. So this is the disease severity. So it is asymptomatic or mild, moderate, and severe. And you can see value of chi-square, so it is not significant. And you can see here the value of phi coefficient. It is not needed since this chi-square is not significant. You don't need to comment on the phi and Kramer V. And just before you go, you can check for the assumptions. So I am just seeing the expected count. So expected count is, you can see here, in that severe one, it is 5.60. So it is borderline. So again, but it is more than 5. So we can say that expected count is more than 5 in all cells. And then you can say that, yes, you can go for the chi-square. Because here, if you come, you can see there are other options. Like chi-square continuity correction, likelihood test, Fisher exact test, etc. Can you see this option? Okay. So since my...
Hello.
I think someone is saying something. Shivam? Okay. So yes, and effect size, you are asking me to explain again. So okay, effect size, I'll show that slide once. Yes?
हेलो हाँ मैम, अगर एक्सपेक्टेड फ्रीक्वेंसी अगर मैम 5.6 का 4 था तो मैम क्या करते हैं?
एक मिनट रुको, लेट मी कम टू दैट. यू वर सेइंग समथिंग, इसके लिए कुछ बता रहे हो?
हाँ मैम, अगर एक्सपेक्टेड फ्रीक्वेंसी सीवीआर में 4 होती है 5.6 की है,
हाँ हाँ हाँ,
तो मैम सेम का टेस्ट अप्लाई करते हैं ना मैम?
कौन सा टेस्ट अप्लाई करोगे?
अगर एक्सपेक्टेड फ्रीक्वेंसी 4 या 3 रहती मैम, इस 5.6 की है,
हाँ,
तो मैम काई टेस्ट अप्लाई करते हैं कि फिशर एग्जैक्ट ही करते हैं?
देखो फिशर एग्जैक्ट जनरली हम लोग यूज करते हैं फॉर 2x2 टेबल. फिशर एग्जैक्ट because it is a 3x2 table. So what will we do? I have told you one way to handle this. And what is that? You club the category. क्या करोगे इसमें? You can club these asymptomatic and mild in one and moderate severe in other.
ओके.
Okay, so because this Fisher exact test, generally it is applied for 2x2, not for like n by n. And this, if the expected count is less than 5, then definitely you should not go for a chi-square. So in that case, you club the category because it is due to the sparse data. In the severe, there are only 21 individual, you can see. As compared to asymptomatic mild, it is 124. So this we often encounter in the clinical, whenever we get data from clinical specialties, since their sample size is too less and their categories are high. So generally we face this problem of getting expected, and this is the expected count less than 5 in many cells. So the solution is club the category. If in 2x2 also you are getting less than expected count less than 5, then go for Fisher exact. Did you get it? All of you. Then I'll come to the effect size. I don't know. Any yes, no? Ajay is writing yes.
Yes, ma'am. Yes, ma'am.
Okay. Shivam, you have understood now? Okay.
जी मैम.
Okay, okay. ठीक है शिवम, thank you. Then हम लोग फिर इसमें चलते हैं, like we can go to this effect size जो अभी explain कर रहे थे. Effect size, this is the strength of association. So effect size largely, there is a effect size is entirely a separate session actually. Okay, because I need to again explain it for 30 to 40 minutes to explain it correctly, the effect size. But just for a basic understanding, I am telling you that how that effect size is conveyed rather. I'm not going into the statistical concept, just for understanding how that effect size is conveyed. So these days you will see that it is not the statistical significance, because always we talk about this p-value, significant confidence interval, narrow confidence interval, and p-value less than maybe 0.01 or 0.05. This effect size is independent of the sample size, because what happens if you increase the sample size by a very large amount, like if you take everyone, if your sample size exceeds like 400 or 500, even if there is a very minuscule association, but that strength of association will be like that p-value will be very much significant. It will be like 0.0001. So from a biostatistics point of view, you will say, yes, this is very much significant. But if you see the clinical significance, it is, if that's why we say that there are two things. There's a clinical significance and there's a statistical significance. So we don't go alone by the statistical significance, because a statistical significance can be achieved with a large sample size. But effect size is independent of sample size. And that's how you define effect size, that if it is 0.1, that is, it is of some clinical implications. If it is 0.3, 0.1 to 0.3, you say that it is of moderate clinical implications. And if that means clinical implications, that means in evidence-based medicine, I may use this information as a treatment change, or probably to monitor the treatment or see the prognostic value. And for a large effect size, that means this is definitely very much clinical significant for me as a clinician to practice this evidence-based medicine. Because just the statistical, like, for example, if a new drug has come and that is reducing the blood pressure only by 1 millimeter, but it is very costly, and already the patient, or maybe it has got a pill burden. So maybe what will happen, if you increase the sample size, this 1 millimeter reduction in systolic blood pressure will also be a statistically significant, and it will be proved. But if you don't give the effect size, as a clinician, for me, it does not matter like if the drug is very costly. Why will I gain a 1 millimeter reduction over a more of input when the drug is costly? Maybe some more side effect is there. I'm not sure, but just to make you understand regarding the concept of statistical significance versus this effect size, which is the clinical significance. Have you understood the difference? So this gives you the strength of association. And strength of association, if you can recall your various criteria of causality, then strength of association is one criteria. Okay, so Dr. Varalakshmi is writing that to some extent. Yes, you will understand this more when we'll see the independent sample t-test, ANOVA, and maybe it is like more you see, more you will understand. So that's why I said that it is entirely a separate topic, this effect size. But we are not going into those details. Why? Because first thing is not for everyone, just for understanding, you think and you should report the effect size. First thing, as a researcher, wherever there are such hypothesis testing, you should report effect size. And when you report effect size, it is clear to the reader. And you will write also that whether it is a small effect size or a medium effect size or a large effect size. So that value of effect size will definitely convey to the reader about its clinical significance. So, but it is commented only when there is a statistical significance. This is the second step. If your statistical significance is not achieved, then we don't comment, especially in chi-square. Then we don't comment on the effect size. So coming to this movie, so we have understood this. Now, second question, I have shown this to you. Since all the expected cell count is more than 5, so my assumptions are met and I can go for this. So this is not significant. Coming to the second question. So this was just the table and I have written this. You can see this, the description. So you can use these days, many of you know about the ChatGPT, and you can use the ChatGPT also to aid you in writing the interpretation. Like let's say, if you just, I'm just seeing whether it does it or not. If I copy this, and this is, suppose this is a ChatGPT, and I have pasted this here. And then I will write that, although I have not written the, please write the interpretation. I need to write other things also, like research question. Maybe you need to make this learn. I don't know how it responds. I'm just seeing. So,
Ma'am, without any objectives or other things also, it will just interpret it, our table.
Yeah. So that's, I was also just checking, Naveen. So you can see that it writes that observed or moderate. And I have given, I think, expected also. So maybe that's why. But it will write and then you can modify it accordingly. If you like make this read regarding the research question and write one paragraph, if you instruct this that write the result in, let's say 75 words or 100 words, it will give you the result as such. If you give so you can keep on experimenting if you wish to do that, but again, putting your brain, yeah. You have to use your brain, definitely, Dr. Anand, because it is just an AI, and I was just telling you that for maybe initial this thing, it gives you a little guidance, and your brain is definitely the most important thing, because it might write anything, but you need to see how it is writing. Okay, so you need to put your brain finally. You cannot go the way it is writing. Okay, so yes, I very well agree with you. So this is the one, and again I will if you go here, I will remove this expected count, and now you can see I will write this percentage here. So this you can have in your final this thing. You can copy this, and since this is not significant, can ChatGPT be quoted? Yes, we were going through the Lancet publication. This thing, they said that it should not be acknowledged, something like that, no?
ChatGPT should not be acknowledged.
No, they said that they know that people use AI. We were going through the Lancet guidelines for publication because we were.
They are using.
So they are also using. They have clearly written that they don't discourage the use of ChatGPT, but you cannot acknowledge, like in citation, you cannot give ChatGPT. See, ChatGPT, how will you code that in manuscript? I didn't get, Dr. Anand. Means quoting means, what do you mean by quoting? It's not like you cannot give a citation. Understood? It is just like if you are, like if you have to, for a beginners maybe, and just to aid you in writing a description, because not all of us are very well versed in writing a description, probably for a longer one. So it can aid you in writing a description, especially for people who are belonging to a Hindi belt. Okay. But ultimately, you have to put your, yes, definitely. It aids in language. You are right. Because that framing of language, many times you are not very confident whether the language, kind of language you have written, whether that journal is going to accept it or not. Because although in Hindi and in many local language, you can express that in a better way. But when you submit your manuscript, many times you will see that, and that's how, what do you think, that these journal, whatever they writing assistance, which they are, if you publish a journal, they will always ask you to go for taking help from them in drafting the manuscript. They also use AI. So it is only to aid you in framing language. Ultimately, you are going to interpret it, because that is, they are not the researcher. They are the AI. It is an AI which only can help you to frame a better language, technical language, which the journal can accept probably. Because you see that whenever you read the Lancet and NEJM and other journal, you will always find that, maybe as Indian or maybe as a, especially I'm talking, we are working in an area where majority of these places, people are Hindi speaking. So they again, and that too clinicians. So you will see that clinicians, they are always in this thing that they don't have much of the time, and the students are coming to us. So they themselves are exploring. Even if we are not telling them, they are smarter than us. And they came to us showing this, that this is working. This is working. And then we also realized, oh yes, this is working. Okay. So now, coming to this, now we'll go to another, this thing. So this is the interpretation. You can see this. This we have written. This is not through ChatGPT. That a chi-square test of association was conducted between oxygen requirement and smoking status. And here we have written all the assumptions. So it is requested from all of you, you can write the assumptions. You should write the assumptions. So I have written that all expected cell frequencies were greater than 5. Males had a higher proportion for, okay, this was, I think, for some other status, this thing, not for smoker. Let me see the gender and CVD oxygen. So this, I think we have not written, but yes, you can write that. Okay. So now this, we will go to the another test of proportion, which is the chi-square test of 2 proportion. So I'll go to this now. So have you understood that chi-square test of association? Then we'll go to another variant, which is the chi-square test of proportion. So maybe we'll understand this effect size more tomorrow. And if time permits, we may take a session on effect size. We'll see again, because it's now 4 and we are still left with 2 sessions and 2 breakout room. I don't know whether it is possible or not, but we'll try. So now coming to the chi-square test of two proportion, chi-square test has got various variant. Till now, we have only learned chi-square test of independence or test of association. And this is a contingency table. There's another thing which is known as the chi-square test in one sample. I'm not going, that is the goodness of fit. So we are not covering that since that is not very commonly used. I have not seen people using or reporting these days. So that the most commonly done is are these two type of chi-square test of two proportion and chi-square test of independence. So this we'll go with the basic concepts, then research question, assumptions and hypothesis, commands and interpretation, and summary. So coming to the chi-square test of two proportion, in this case, the difference from the chi-square test of association is in the study design. Remember, because the computer doesn't know. But here we start from two different samples since beginning. So there are two independent group, and in this independent group, we are seeing something which has got a dichotomous distribution. Dichotomous means yes and no. And third is your chi-square test of homogeneity. It is also known as chi-square test of homogeneity. So there is something known as the binomial proportion. So what is a binomial proportion? So suppose you have recruited 50 males and 50 females. Again, I'm not recruiting 50 husband and wife. And I'm not seeing like in 50 wives and 50 husband because there should be independent samples. So 4 males had a heart attack and 8 females had a heart attack. So I have started from an equal sample, and then what will be the proportion of females having heart attack? Okay. We always correct this slide, but I don't know always this. So this is just reverse. This is, you can see this is male. Please read this as male and please read this as female. So you can see that proportion of heart attack in male is 8% and in female it is the 16%. And proportion of males not having heart attack is 92 and proportion of females not having heart attack is 84%. So it is yes and no. So what could be the potential risk research question for which we need the chi-square test of proportion to proportion of homogeneity? So homogeneity means I am saying that they are equal in both the group. So if I want to know whether the proportion of BMI category, and here it should be a binomial proportion. That means only two proportion. That's why its name is also chi-square test of two proportion of MBBS students of AIIMS Patna and AIIMS Delhi. So I have taken the students from two institutes and I want to see whether the proportion of BMI, which has been classified as normal or high, is same in both the institute or not. The second research question could be whether the surgical site infection rate, which has been classified as present or absent in two units, which are the unit 1 and unit 2 of the surgery department, is equal or not. And the third research question could be if there are two populations, like COVID cases are being reported from rural and from urban also. So what is the proportion of COVID cases as present or absent, whether they are equal in rural and urban area or not? So in all these three research questions, what we have seen that there is a proportion of various categories of a nominal variable in the study and whether it is equal across different population or not. So the appropriate statistical test is the chi-square test of two proportion or chi-square test of homogeneity. Now, what is the difference? How this is different from chi-square test of association? So I said that basic difference is in the study design. In chi-square test of association, you start with a set of individual and you ask regarding the variables. So you start with one population and then you look for association between the two categorical variables like diabetes and obesity. But in chi-square test of two proportion, since beginning you take two separate samples. So you take non-obese people and you take obese people separately and of equal number. And then you see in obese, how many of them are having diabetes and no non-diabetes. And in non-obese also you see how many of them are diabetes versus non-diabetes. So have you understood the difference between the two study design? The difference is in study design. If your study design is of first type, then you will apply chi-square test of association. If your study design is of second type, then you will apply the chi-square test of two proportion. So then what are the underlying assumptions? So the underlying assumptions are there is one dependent variable and there's one independent variable, but both should be measured on dichotomous level. And there should be independence of observation. Like I said, AIIMS Delhi and AIIMS Patna, or both two units should be different. It should not be related to each other. And it is used for only certain type of study design, which I have just emphasized. And the same expected cell frequency should be greater than 5. So what is null and alternate hypothesis? So null hypothesis states that the proportion, the binomial proportion, is same in both the two populations. And the alternate hypothesis states that they are not equal. So chi-square test of proportion can be used in two types of research design. First is if we are doing the random sampling from two independent population. Like there's a group of doctors and there's a group of nursing personnel. And we have recruited these two groups separately. And we are seeing the diabetic versus non-diabetic in group 1 and diabetic versus non-diabetic in group 2. And then we see the proportion in these two and we compare the proportion. So this is again random sampling from two independent population. Or if we are doing the random assignment to two intervention, like we have assigned few people to intervention 1, few people to intervention 2, and then we are measuring the outcome, which is the binomial, and then compare the proportion of outcome in two intervention. Then also we can apply this chi-square test of two proportion. So now how to do that? I'll see the question. So coming to the chi-square test of two proportion. So there are two type of hospital A and hospital B. And if I want to know the proportion, whether the proportion of male and female COVID cases in type A and type B are equal or not. Okay. So how will I do that? This is the data set. So it's the same interface. So type of hospital. So type of hospital is your independent variable. So if this is the hospital type, so independent variable, I'll move to rows and COVID cases, male and female. So this is gender. Gender, I'll move to column. And then here in the option, you will see, this is the option which I need to check. Z test for difference in two proportion. This is the Z test for difference in two proportion. I have clicked that. And then you can see that this is again, it's not significant. And if you see that proportion of male in type A was 67% and in type B it was 78%. Again, in female it is 33% and 22%. So it is not very much significant. So the value is again, this is not significant. So this is how we apply and interpret the chi-square test of two proportion. So if any other question is there, we can take those questions. Otherwise, we'll go to the breakout room. Any message was there from a participant?
What is the degree of freedom?
Okay. Degree of freedom. So I think we have one PPT. I'll explain that. हाँ है मैंने देखा है. Let me explain you because we were wait, I'll show you degree of freedom. मैं बता रही हूँ
मैंने देखा इसमें ऐसा नीचे नीचे पूछो कि नीचे नीचे
So I'm just okay. So Tandra is writing what is likely. There are many questions. Okay, let me tackle. See all these questions. Can you go? No. Huh? Prashant is writing, if you apply chi-square test of proportion, will there be only be difference in result? I did not understand this. Okay, you are saying that if we apply the chi-square test of association or proportion, will the result be same or different? If the value will be, let's see. Let's see. You are saying that instead of this Z test, if I use this chi-square, so you will see that this value of chi-square is different. 2.96 and Z test of it is 1.72. P value is same. Okay, interpretation will be same. It's different, right? Because I said that it is the basic difference in the study design and your research question. That's how it is different from the chi-square test of association. Now the second is, after this, please explain about wife and husband concept. Okay, I'll explain that. How it is different from Z test. This to ho gaya. What is likelihood ratio? Okay. So likelihood ratio, again, you can see there are few options here. There is one. So should I tell degree of freedom first or should I explain these continuity correction and likelihood test? Can someone guide me? New message. Degree of freedom first. Your choice. Okay. If it is my choice, then I'll first explain these because then I am done with these options. So thank you. This continuity correction is done when the sample size is less than 40. Generally, it is said, I'm not going into the many statistical jargon because there is something known as the chi-square distribution. So chi-square distribution, if you see, it is continuous in nature. But if you apply it to categorical one, for a smaller sample size, this chi-square distribution is not continuous. So that's why we need to apply continuity correction. So just for understanding, think that if the sample, if in the individual cell, if the expected is less than 5, in n by n, for 2 by 2, you can go for Fisher exact. Like one person was asking just before some time that in the severe, if the Shivam asked this, yes, that if in the severe category, the expected count was 4, what could have been done? In that case, either you can club the category or you can go for this continuity correction. Generally, continuity correction is done when in the individual cell, the expected frequency is less than 5. You can go for the Fisher exact if it is 2 by 2. If it is n by n, you can go for chi-square continuity correction, which is also known as Yates correction. Okay? Yes, Shantanu has written correctly, Yates correction. Now coming to the likelihood ratio. So likelihood ratio is again one way of calculating the chi-square value. And for very large sample, we use likelihood ratios. You understand only this because we also don't know much of the statistical reasoning and the formula. The only thing which I have understood that for larger sample, too large sample, the chi-square, it gives you a very inflated value of significance. So for larger sample, you should use the likelihood ratio. If you click this, for this now, let me go with the another previous example. The association thing. Smoker as an oxygen requirement. And if I apply this chi-square continuity correction and Fisher exact, just see the difference in value. So in continuity correction, what are you seeing? That the p-value is not significant. Can you see this? 0.07. Value of chi-square is also not, it's less. In case of a likely, so you can say that this, if continuity correction is significant, that is very good. That means there is no way that chi-square value will not be significant. If you see the likelihood ratio, you will see that here also it is 0.043. So there is some change in the p-value and the value of total value of chi-square. So remember, continuity correction is applied when in n by n table the frequency is less than 5. Likelihood ratio, in case of a very large sample, it will always, many times it shows the significance. That's why you have to go for this correction. And Fisher exact we apply for 2 by 2 if the individual cell count, expected count is less than 5. Have you understood up till this point? Someone is talking. So who has asked this question? Okay, understood. Then we'll go to the another, that is the degree of freedom. So this is these are the few slides about the degree of freedom. I'm not going to tell you the statistical formula because you all know the statistical formula of degree of freedom. That if it is a continuous, this thing n-1, otherwise you multiply row -1 multiplied column -1. That is a statistical way of calculating the degree of freedom. So this is the conceptual thing of degree of freedom. So if like this is just what in this picture, what can you see? So there's a one girl who is confused. That is always there with the girls, what to wear. So we have several clothes in our almirah, but we always complain that we have got nothing to wear. I mean, we have got less of choice, right? So we are confused. So this girl is confused what to wear on weekdays and weekend. Okay. So like she has planned to put 7 dresses in the cupboard for 7 days, right? So she has started on Monday with dress 1, on Tuesday, dress 2. Till Saturday, she wore all the 6 dresses. So till Saturday, she has the option to choose. But on Sunday, do you think that there is any other option? What is your answer? On Sunday, holiday. No, if she has to go out, then what to do? She has to wear that and she has to go out. Then what to do? So she has got no choice. Since she has fixed 7 dresses, so only 1 dress is left. Okay. So she has to wear that only on day 7. So she was having this freedom of choice, dress choice for 6 days. She had some choice. Even on day 6, she had a choice between 2 dresses. But on 7th day, she has got no option. So she has to put the 7th option. That means that is not an option for you. That is not a freedom for her. She has to wear that, right? This is one way. Now coming to data set. So suppose you have measured hemoglobin for 3 females and you know that the mean hemoglobin level is 11. Okay. So you have got these 3 situations. Focus now on situation 1. So you have seen that the first female has got value of 10. The second female has got value of 13. So can you put any other number here if you know that the mean hemoglobin is 11? What is your answer? Yes and no? No, because this is fixed. These 2 you can choose. But the moment you choose these 2, this third is fixed. Similarly, here, now you focus on the second situation, 9 and 10. Again on the third, 11 and 12. So in all these three options, do you have any freedom for the third cell? So what will be your answer? No. So in any situation, you observe that the last value is always fixed. You have got no choice. So you have got n minus 1 degree of freedom. Means for the other two values, you can have that, but for the last one, you have got no choice. That means it is fixed. So the degree of freedom means you are free to choose only for two cells. So that's why it is n minus 1. Have you understood up till this point? No, yes, no, no. I cannot say. No, there's no. Shantanu has written clinical interpretation. I'm not going into the clinical interpretation. Only degree of freedom. If you want to understand that clinical interpretation, it's the biostatistical interpretation, because depending on the degree of freedom and chi-square, if you remember that table in that hard copy, which is there in the back of the statistical books, then you can go and take the example. Yes, any other example is there for the statistical, this thing, 2 by 2 table. So suppose you took a sample of 40 cases, recorded their gender and cardiovascular disease, where 16 females and 24 males are there. So 12 has a history of cardiovascular disease and 28 don't have such a history. So you have arranged that in 2 by 2 table. So number of males, 24. Number of females, 16. CVD is there in 12 people and absent in 28 people. So total of 40 people. So what is the degree of freedom in 2 by 2 table? You always write row minus 1 into column minus 1. So there are 2 rows and 2 columns. So the degree of freedom is 1. How to understand this? If you put this value of 1 here, can you deduct the other values in the other 3 cells? What will be the value here? What will you write here in this cell? 23. Okay. What will you write in this cell? This cell? 5. And what will we write in this cell? 11. So the moment you have got only 1 degree of freedom, that means only one cell it can choose. The other 3 are fixed. This we mean by degree of freedom. That's the intuitive meaning. The statistical concept is there is a formula, and based on the degree of freedom, you choose the p-value, you choose the particular t value or the chi-square value, if you see that in the tabular format. So this is again the same example. You can keep on changing this and the other 3 values will be changed. Similar, this is again the same example if you take 3 by 3 table. So Prashant is writing, if you select one value, all other values are automatically fixed. Yes, that's why I have only 1 degree of freedom. That means I can only change that. And this happens with the data. Like the data cell, it moves. How it is calculated means that rationale, why it is so, that thing, even I don't have much intuitive meaning from a statistical point of view. We have only understood in this term that in 2 by 2 table, like this is a 3 by 2 table. So again, I have selected these 40 women and 40 study subjects, 24 male and 16 female. And the no anemia is 12, moderate is 18, and severe is 10. So if I have got these 2 cells to choose, so I can keep on changing these 2 cells and then the other values are fixed. You can try this out. Either I can choose 1 or 6, 2 or 3, and then the moment I choose these 2 cells, other 4 are fixed. So the degree of freedom for this 2 by 3 table is 2. How do you calculate? 3 minus 1, because there are 3 rows, 2 rows and 3 columns. So 3 minus 1 into 2 minus 1. Ultimately, it is 2. And this is the meaning, right? So this is how we understand this degree of freedom. Maybe more intuitive meaning, and like Dr. Anand, which he has raised one issue that we'll try to see. Maybe we will explore more on that. Or if any other participants have understood it, maybe you people can also share. Because I said in the beginning, we all are learner. You are also learning, and with you, we are also learning. So if any other insight is there with all of you, kindly share your opinion also to us, because it's a mutual learning. So if we have understood up till this point, we can go to the breakout room. Can we go? Are we ready to go to the breakout room? Because it is 4:30.
Ma'am, I have one question.
Please, Dr. Anand.
Huh. Ma'am, if we put two values, male and female, then it is not possible. So in that case, we have to put values only in columns and not in rows. Is it correct?
Oh, can you please repeat your question?
We have freedom to put values only in columns, either of the two column,
Okay.
and not in rows. Is it correct?
Yes. Yes, you are right.
हाँ
Because
हाँ
you cannot choose this and this.
हाँ 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 हाँ.
Yeah, you are right. Okay, I think then we can go to the breakout room. Dr. Anand is stuck on that chat GPT, I guess. You can move ahead. You can choose what to do and what not to do. It's up to you. Everyone is free to use a particular option, which, yeah, there are people who wash their clothes with hand. There are people who use washing machine. There are people who use automatic washing machine, whether the clothes come after getting dry.
Laundry.
And there are people who send it to laundry. All the options are there. It is up to you what you want to use.
Given.